Hello and welcome to the ThinkTree discussions. My name is Kush Kumar and today I'm talking to Gwyn Featonby. Hello Gwyn.
Hi Kush.
So Gwyn, tell me, what do you do here at the Natural Health School?
Okay. Well, I'm the lead educator for the NHS Natural Health School, so we're located here in Harrogate as part of Harrogate District NHS Trust. Mm-hmm. And we are, I'm very proud to say, the first and only NHS complementary therapy school, which is wholly owned by NHS, and all of the people who work within the school, we're all NHS employees, so I think that's a great boon for our industry.
It absolutely is, it absolutely is. So what's significant about this centre?
Okay, well, firstly, as I've said, we're the only centre to be operating as part of a trust, so we're not just hiring facilities, we are actually an NHS portfolio business. And what's different about us is we really recognised, I think, that there are fantastic complementary therapists out there, but a great deal of disparity in terms of training and experience. Lots of therapists who would be a real positive, would have a very positive impact on our NHS patients, but either they can't get a foot in the door, they can't come and practice, or they want to come and practice with NHS patients, but they simply don't have the relevant safeguarding training that would be acceptable by the Care Quality Commission, our healthcare regulator in the UK, to enable them to work effectively and safely within hospital premises. That said, we're not just about training people to work in hospitals. We very much recognise that the standards of care that we provide through our NHS are very much acclaimed worldwide, and we want to bring complementary therapists truly into that status, that clinical status, where they can work effectively within their own practices with much more complex patients.
So what kind of training might they come and get here?
Okay, well, we offer training right from foundation level, so we do offer foundation training in a number of therapies, including aromatherapy, reflexology, massage, also EMET training. We have some bone training going on here, so students can come and learn from a foundation level. But our real spec, I suppose, is to take people who are already qualified and engage them within the NHS Natural Health system, so working in an integrated way within the hospital. So we offer a number of programmes. We offer a certificate in cancer and palliative care. We also offer a very unique training programme, and that's the NHS Certificate in Complementary Therapies. And that's for practitioners who have a foundation qualification. What we do with those practitioners, we bring them in for some theory days to bring them up to the safeguarding standards that would be required of all clinicians within the NHS. And then we offer them 100 hours of supervised clinical practice with clinical supervision and tutorials to actually engage with that practitioner to develop their own objectives, really, along with the core compliances required for working within the NHS. So we bring those together to make unique portfolio systems. So those practitioners, those learners will work through that programme with us within the hospital, working with real patients.
So there's a whole kind of from start to finish support mechanism in place, and obviously you're making sure that people are fit for purpose, but also able to work within the NHS.
Yeah, that's right. Yeah. So it's all really about taking people who've got a good base qualification and extending their practice and experience to enable them to work with more complex patients.
So I guess therapists could come here with a prerequisite in a level 3 qualification.
Yeah, that's right. Yeah.
However, do you then, if somebody didn't have that, can you accommodate them as well?
We can't accommodate them on the NHS certificate unless they have a prerequisite minimum of level 3 qualification, and that qualification must be something that sits on a framework, so it's been externally quality assured. So those practitioners are very welcome to apply. if people want to come along and they haven't got that, what we would do is go through a mapping process with them to find out where their gaps are, and we would put them into a level 3 programme with us to actually get them to the standard so that they could then progress. So we accept every learner is different, so it's all about working out what the gaps are for individuals. Some will have lots of experience but not necessarily the theory to underpin their work with more complex patients, whereas others will have a lot of understanding of the theory but won't have had the experience or the opportunities to work hands-on with complex patients. So we like to think our strapline is "you matter most," and that's what we apply to the patients. And very much the ethos of the school is that we take those same core values and apply them to our students. So we like to think we work with small numbers, lots of individual attention, and really about finding out what that particular learner needs to get to where they want to be. So it's very much a process whereby we engage with the learner individually to plot and plan their own individual portfolio.
Excellent. And I guess your background and your team's background is essential to what you're doing now. So tell us a little bit about your background.
Okay, well, my background originally was as a nurse, so I practiced as a nurse for a long time. My speciality was specifically cancer and palliative care, but also paediatrics. I did about 20 years working with sick children. So a mixed background. I've also been a complementary therapist using a number of different modalities for probably about 35 years now, so a significant period of time. And I've previously operated a school as a social enterprise for another health organisation. So as I came to this, down to Harrogate as part of the team to start the school, once we've got the business plan going for the school, really I've taken on more of an education role than ever before.
And I do believe you've been in education for a while as well. You've taught for foundation degrees and degrees, and are an external examiner as well for some.
I have been, yes.
Yeah.
Yes.
So all of that kind of experience and knowledge that you've gathered over the years has brought you to this point where you're able to offer lots of guidance, support, experience and knowledge, understanding for those who want to get involved now in this industry and especially work with the NHS.
That's right. I think it's very important though to be absolutely clear that no one person can do this. I've worked with complementary therapies and worked within the NHS for more than 35 years, but never been able to establish an NHS school. And that came about because two people here, particularly Sarah, who manages the wellbeing services here at the Trust, and Julie Crossman, their complementary therapist, the lead complementary therapist, did a lot of background work. So it took 4 years in the making to get that business plan through. A great deal of work in that 4 years, collecting data, collecting evidence, using patient-related outcome measures to actually gain the evidence required by the Trust to demonstrate that complementary therapies actually work. They make a very positive difference to patient recovery times. They make a very positive difference to symptom scores for patients. They're really, I can't even express how important for the complex patients that we see here, how important complementary therapies are. So it took 4 years to collect all of that data, and that's fundamentally what was used to get a business plan through, to demonstrate that yes, we absolutely need this, but also from two separate ways, Julie and Sarah and myself, we've both been employers of complementary therapists, and it's very, very difficult sometimes to actually take a complementary therapist at word of their certificate, because we find we might have 10 people applying for a job with exactly the same certificate, but their standards of care, their levels of experience, they're different. You know, it goes back to there's a great deal of disparity within the industry, and I think what we want to do is bring everybody up to the same standard that every other clinician within our modern healthcare system is required to work to. Very important.
That's excellent, and that again is a benchmark standard that you're raising. So what else is planned here at the school?
Well, over the past year, we actually only launched last May, so we've only really been operating officially for 10 months. So It's been fantastic. We're doing really well with subscribing people to the level 3 foundation courses. The CPD courses are going very well. We have a lot of interest. And we had an awful lot of interest with the NHS certificate using the cancer and palliative care pathway, which is really our speciality.
Right.
But that said, we're sitting in a hospital with hundreds of poorly patients, hundreds of complex patients, and we know that there is a lack of equity when it comes to complementary therapy provision for people outside the cancer domain. So we know that lots of cancer centres, so we know that lots of hospices offer complementary therapies to their patients, but what about other people with long-term chronic or complex illnesses? So we're currently working with patients in the stroke unit, we're working with the maternity unit, we're working with the occupational health unit, we're working with the pain nurses. So what we're looking at is developing pathways using the expertise of clinicians within this trust to develop portfolio systems for people who don't necessarily want to work with cancer and palliative care patients, but may want to have that opportunity to gain experience with more complex patients. So that's very exciting, and I think it's a real, it says a lot about this trust that this project has been so embraced throughout the hospital community.
It certainly is, and it's certainly within the industry, it's a real kind of opportunity, I think. So, if our viewers want to be recruited or be part of this, obviously they can come to our website, they can find your courses. But what's the kind of lead time, and how often are you running courses here?
The courses we run, level 3 diplomas, we run twice a year, so we have a March intake and an October intake. Okay. Other courses you can find on the website. The NHS certificate, we currently run 2 sets per year. Okay. And that really is more about the availability of myself and Julie as the only supervisors that we have here currently. It's the amount of students that we could take. So we are looking, we do get lots of questions from students who want to do the NHS certificate, but they want to know, can they actually do their clinical practice in their local trusts? Currently no, because it's licensed purely to this trust. But what we are looking to do over the next 2 years is to have other trusts to take on that license, and we would then train their supervisors, so that again it's about not wanting to have a postcode lottery. We know that here our patients get a fantastic service, they get lots of opportunity to access complementary therapies as part of their treatment journey, but we don't want that disparity. We want other trusts to be able to offer the same level of care to their patients. So that's really what we're working towards, that's what we're moving towards.
Excellent. And how do ThinkTree members benefit then?
Well, ThinkTree members benefit. We know that ThinkTree members are serious about their careers, their profession, about standards. So for ThinkTree members, they do get discounted training through ThinkTree. They get discounted membership through our package. So they will also get CPD points for ThinkTree when they study one of our courses. So it helps to fulfil their ongoing registrations, and it's really about assuring any students, any potential learners who come through ThinkTree that they will receive the level of training and the high standards of support that they would expect.
Excellent. Well, thank you ever so much, Gwyn, for talking to us today. So if you're interested in being part of this programme, if you're interested in being recruited for the level 3 or the shorter workshops or the CPD, then please come to our website at ThinkTree Hub, and also you'll find links there to the Health
NHS
School,
Natural Health
School as well, and yeah, it's a fantastic opportunity to make a difference in the industry, and this is what we've been looking for a while, and we are very, very proud of this school here, as it's the first one and the only one at this moment in time. So thank you very much for watching.